Your child's central venous catheter's dressing will have to be changed once a week or sooner if the dressing becomes loose or soiled. Before leaving the hospital, your child's central line care nurse will instruct you on how to change the catheter's dressing. Before changing the catheter's dressing, be sure to wipe down all work areas with disinfectant wipes. Supplies needed to change your child's catheter dressing are in the dressing change kit. This includes a sterile glove package, a chlorhexidine wand, skin protectant, a biopatch, sterile dressing which has two parts, the window dressing and the anchor piece, white tape strips, and a mask. You will also need additional masks, non-sterile gloves, adhesive remover, and a securement device if your child has had a peripherally inserted central catheter or PICC inserted. Begin by washing your hands thoroughly with soap and water or scrub your hands vigorously with a hand sanitizer. Rub your hands together for 15 seconds each cleaning period, whether you use soap or hand sanitizer. Put on the mask. Everyone in the room, including the child, must wear a mask during the dressing change. Put on clean, non-sterile gloves. Examine the dressing before removing it. Check for redness, swelling, or drainage under or around the dressing. If any of these things are present, please call your child's doctor before going ahead with the change. Begin to remove the dressing slowly and carefully. Start at the edges and work clockwise around the dressing. Adhesive remover can help loosen the tape. Once the edges are free, remove the window portion of the dressing by gently lifting upward towards the central venous catheter exit site. Carefully remove the biopatch. Remove your gloves. Please wash your hands again thoroughly with soap and water or scrub your hands vigorously with a hand sanitizer. Rub your hands together for 15 seconds each cleaning period, whether you use soap or hand sanitizer. Open the dressing changing kit and remove the wrapped sterile gloves from the package and place it on your work area. Open the gloves carefully to make sure they remain sterile. Look over to ensure that there is no damage to the gloves. Only the outer borders of the package, which is 1 inch around, can be touched by your non-gloved fingers. The clear pouch of the kit will be your sterile field for the dressing change. With the hand you usually write with, grasp the opposite glove at the folded edge of the cuff. Pick the glove up by the folded edge. Slip your hand into the glove. Keep your hand flat and your thumb tucked in. Pull the glove on. Be careful not to touch the outside of the glove. Touch only the part of the glove that will be next to your skin. Leave the cuff of the glove folded. With your gloved hand, slip your fingers into the folded cuff of the other glove. Pick up the second glove. Slip the glove over your fingers. Keep the hand that you are putting the glove on flat. Keep the glove thumb up and back to keep from touching your bare palm or wrist. Pull the glove over your hand. Adjust each glove to get a snug fit. Reach under the cuffed part to pull up or adjust. Once you have your gloves on, keep your hands in front of you and above your waist. Do not touch anything outside of the sterile field. With the chlorhexidine wand, squeeze the wings on the wand to release the soap. Start cleaning around the exit site of the catheter, starting at the exit site and moving outwards, cleaning from the inner area to the outer area. Scrub back and forth and up and down for 30 seconds to cover a 4-inch border around the exit site. Let the soap dry completely. This usually takes about 30 seconds. Do not fan or blow on the site. If your child has a PICC inserted, you will apply the securement device at this time following the application instructions. Place the biopatch with the blue side up and wedge around the exit site of the catheter. The biopatch has chlorhexidine medication in it to prevent infection that lasts for 7 days. If a skin protectant is part of your child's skin care, apply the skin protectant where the dressing edges would be using the skin prep wipe. Do not wipe at the exit site. Allow the skin to dry completely, which takes about 30 seconds. Do not fan or blow on the site. Pick up the dressing and remove the backing on the top half. covering the window part to expose the sticky part. Center the dressing and put the sticky part down, securely so that there are no creases in the dressing. Remove the backing to finish the dressing. You may use the anchor piece to wrap around the tube coming out of the dressing. White tape may be used to hold the tubing in place. Once you have completed the dressing change, masks can be removed. Please wash your hands or use hand sanitizer again. Some important tips to remember. The catheter should have a sterile dressing on it at all times. Change the dressing right away if you notice that it has become wet, loose, or dirty. Dressings are changed every 7 days otherwise. A sterile item that touches a non-sterile item is not usable at that time. Do not use any items that have fallen on the floor. Only use items that you have opened at this time. Supplies should never be reused. If a dressing change kit is not available, your child's central line care nurse will go over instructions for changing your child's catheter dressing. If you have questions about the dressing change, please contact your child's central line care nurse. Thank you again for choosing Cleveland Clinic for your care.